This video covers the following topics. 1. Narcissists and their psychotic nature. 2. Consequences of narcissists' abuse and complex post-traumatic stress disorder. 3. Treatment for complex post-traumatic stress disorder and metacognition. 4. Resources for narcissism survivors with complex post-traumatic stress disorder. 1. Narcissists and their psychotic nature. Narcissism is comprised antisocial personality disorder, aggression, sadism, and always ready to raise hostility levels to dehumanize people they select as victims. When they have selected their victims, known as scapegoats, they will abuse them as disposable things, and they justify their tortures, manipulation, and exploitation of others as acceptable because they assume they have the right to do whatever they want with them, even if this means killing their victims. This belief system is a result of the narcissist's complete lack of empathy. It is also a defining characteristic of psychopaths. In much of the literature, the terms narcissist and psychopath are used interchangeably. However, narcissists, contrary to psychopaths, are fully aware of the difference between true and false, real and make-believe, the invented and the extant, right and wrong. The narcissist consciously chooses to adopt one version of the events, an aggrandizing narrative, a fairy tale existence, a what-if counterfactual life. Therefore, narcissists are the most dangerous and cruel creatures than psychopaths. Narcissists are manipulators and their delusions are in the service of their stratagems. Therefore, their chameleon-like ability to change guises, their conduct, and their convictions on a dime. The narcissists try to convert their social milieu to their point of view. They attempt to condition their nearest and dearest to positively reinforce their delusional false self. The most telling thing that narcissists do is to contradict themselves. If their lips are moving, it's because they are telling lies. Do not believe a word narcissists tell you. They will contradict facts. They will lie to you about things that you do together. They will misquote you to yourself. If you disagree with them, they'll say you're lying, making stuff up, or you are crazy. Narcissists will create problems on a daily basis for their victims, or scapegoats, to clean up. This is exactly what my family, Daniel, Carmen, Elizabeth and Arthur did. While gaslighting me, I was worthless and stupid. In addition, they will create dramas for you to be drawn into so they can feel they manipulate you. For example, my mother, Carmen, would throw herself to the ground, injuring herself, just to create upheaval to draw attention from me and the Golden siblings. When I started videotaping her psychotic behavior, immediately she has never displayed such psychotic episodes of upheaval again. 2. Consequences of narcissists' abuse and complex post-traumatic disorder. Narcissism survivors are typically overwhelmed with feelings of guilt, shame, and feelings of hopelessness. Such undesired feelings most often turn into distress, anxiety, depression, weight problems, panic attacks, self-harming behaviors, and suicide. It is important to realize that there are huge differences between the levels of abuse the victim of a narcissist has suffered. These victims experience abuse on every level of the self, the mental, emotional, physical and spiritual. Ultimately, narcissism victims develop complex post-traumatic stress disorder. Until present days, the majority of therapists haven't begun to ask questions, such as what have narcissism survivors got in common, and what the causes of such distress are. In addition, these victims show signs of emotional and psychological trauma, which every therapist is required to know is the result of extraordinarily stressful events that shatter a person's sense of security, making them feel helpless and vulnerable. Little or nothing has been written in journals regarding victims of narcissists' abuse and consequences of that abuse on those victims. It's important to mention the world is experiencing a narcissistic epidemic, and through lack of information, most therapists have little or no knowledge in this area, especially regarding narcissism abuse survivors who have developed complex post-traumatic stress disorder. Complex post-traumatic stress disorder is a psychological wound that results from prolonged exposure to narcissism abuse trauma with lack or loss of viable escape route for the victim, thus developing learned helplessness, such as child neglect, childhood emotional, physical or sexual abuse, repeated violations of personal boundaries, long-term objectification or scapegoat, exposure to gaslighting and false accusations, long-term taking care of mentally ill or chronically sick family members, long-term exposure to narcissistic family crisis conditions. Narcissism abuse victims show behavioral difficulties, such as impulsivity, aggression, sexual acting out, eating disorders, alcohol or drug abuse, and self-destructive actions, extreme emotional difficulties, such as intense rage, depression, or panic, and mental difficulties, such as fragmented thoughts, dissociation, and amnesia. When narcissism abuse victims have been trapped in a situation over which they had no control, they can carry an intense sense of terror even after the trauma is removed. This is because they know how bad things can happen. And they know that they could happen again, and they could be worse than before. People who suffer from complex post-traumatic stress disorder may feel uncentered and insecure, as if they are likely to have an embarrassing emotional collapse. They may feel unloved, or that nothing they can accomplish is ever going to be good enough for others. Narcissism abuse victims affected with complex post-traumatic stress disorder may feel compelled to get away from others and be by themselves, so that no one will witness what dreadful event may come next. They may feel afraid to form close friendships to prevent possible loss should another catastrophe strike. Uncontrollable disruptions or distortions of attachment bonds precede the development of complex post-traumatic stress syndromes. Adults, as well as children, may develop strong emotional ties with people who intermittently harass, beat, and threaten them. The persistence of these attachment bonds leads to confusion of pain and love. Trauma can be repeated on behavioral, emotional, physiologic, and neuroendocrinologic levels. Anger directed against the self is always a central problem in the lives of people who have been violated, and this is itself a repetitive reenactment of real events from the past. Compulsive repetition of the trauma usually is an unconscious process that, although it may provide a temporary sense of mastery or even pleasure, ultimately perpetuates chronic feelings of helplessness and a subjective sense of being battened out of control. Gaining control over one's current life, rather than repeating trauma in action, mood, or somatic states, is the goal of healing. Complex post-traumatic stress disorder victims may try to suppress their emotional reaction to traumatic events without resolution because they see no satisfactory resolution opportunity available to them. At this point is where learned helplessness starts to develop, and it should be understood as a symptom of complex post-traumatic stress disorder. 3. Treatment for complex post-traumatic stress disorder and metacognition. Little has been done in clinical studies of treatment of complex post-traumatic stress disorder. In my experience and research, metacognition has produced interesting therapeutic results when recovering from complex post-traumatic stress disorder. About metacognition. Metacognition is, put simply, thinking about one's thinking. More precisely, it refers to the processes used to plan, monitor, and assess one's understanding and performance. Metacognition is one of the latest buzzwords in educational psychology, but what exactly is metacognition? Metacognition refers to higher-order thinking which involves active control over the cognitive processes engaged in learning. Narcissism abuse survivors need to learn how to heal from the trauma inflicted by narcissists. Because metacognition plays a critical role in successful learning, it is important to understand how metacognition can be as a healing and recovery process from complex post-traumatic stress disorder. Metacognition refers to higher-order thinking that involves active control over the thinking processes involved in learning. Activities such as planning how to approach a given learning task, monitoring comprehension, and evaluating progress toward the completion of a task are metacognitive in nature. Because metacognition plays a critical role in successful learning, it is important for narcissism abuse survivors. Metacognition has been linked with intelligence, and it has been shown that those with greater metacognitive abilities tend to be more successful thinkers. Most definitions of metacognition include both knowledge and strategy components. Knowledge is considered to be metacognitive if it is actively used in a strategic manner to ensure that a goal is met. Metacognition is often referred to as thinking about thinking and can be used to help students learn how to learn cognitive strategies that are used to help achieve a particular goal, while metacognitive strategies are used to ensure that the goal has been reached. Metacognition is the process of thinking about thinking. Metacognition has to do with the active monitoring and regulation of cognitive processes. It represents the executive control system that many cognitive theorists have included in their theories. Metacognitive processes are central to planning, evaluation, and problem-solving. Putting metacognition into practice. Encouraging victims to examine their current thinking. What do I already know about why I was victimized by narcissists that could guide my awareness and healing? Giving victims practice in identifying hurtful memories. What was most painful about the remembered traumatic event? Helping victims to recognize conceptual change. Before beginning to understand my thoughts, I believed I was tortured because I deserved, and now I understand that I was a victim of narcissists who have lied to me all the time. Now I have a choice to evaluate how my thinking and overall self-awareness is changing, or not changing, over time. Stated very briefly, knowledge of person variables refers to general knowledge about how human beings learn and process information, as well as individual knowledge of one's own learning processes. 4. Resources for narcissism survivors with complex post-traumatic stress disorder. Remove yourself from the abuser. Talk about it. Write about it. Expose the narcissists for what they are and what they do. Do not live in fear. Rewrite the script of your life using metacognition. What not to do about it. Be fearful of narcissists. Hold it in. Bottle it up. Act out. Isolate. Self-abuse. What to do about it if you know somebody else who has complex post-traumatic stress disorder. Offer sympathy, support, a shoulder to cry on, lend an ear. Speak from experience. Assist with practical resolution when appropriate. Be patient. Do not push your own agenda. Speak in absolutes, tell them to get over it, or try to force reconciliation with the perpetrator or offer surefire cures. Complex post-traumatic stress disorder can be a debilitating condition and represent a greater risk for abusing substances as a way of trying to cope with severe emotional pain. Many people with complex post-traumatic stress disorder also engage in deliberate self-harm. This is a video summarizing the main important aspects about 1. Narcissists or their psychotic nature. 2. Consequences of narcissists' abuse and complex post-traumatic disorder. 3. Treatment for complex post-traumatic stress disorder and metacognition. 4. Resources for narcissism survivors with complex post-traumatic stress disorder. If you're interested, please read on the section below this video about the references used to produce this video and suggested reading. Please, leave your comments below. I wish you peace and thank you for watching this video.